The registered nurse is accountable for the patient. When tasks are delegated to another staff member, it is still the responsibility of the registered nurse to oversee that the delegated task is being done correctly. The registered nurse does not transfer accountability to the delegated staff member just because the nurse asked the staff member to complete the task. Prepare for the Next Generation NCLEX with Delegation Review. Nursing students and graduates focus so much on comprehensive review content and do not put enough time towards reviewing when to delegate. After this video, you will be able to prepare for the Next Generation NCLEX with when to delegate and when not to delegate. So, to delegate or not to delegate. Do not delegate what you can eat. We have heard this time and time again in nursing school, and now it's time for a refresher. Do not delegate evaluation, assessment, and teaching. What is delegation? First, let's discuss what delegation is. Delegation is the act of a registered nurse transferring responsibility to another staff member capable of completing the task. Some nurses have difficulty delegating tasks to other staff members. This could be because the nurse instead just does it his or herself, or because the nurse may not want to burden a coworker. However, delegation is essential because the nurse has so much on their plate, and it will help free the nurse from focusing on other, more critical tasks. Follow the protocol. Remember that the registered nurse should always follow the state's and facility's protocols. Some policies may vary from one state to another or from one unit to another. I have taken per diem shifts to help out short-staffed unit and learned very quickly that the unit may handle situations differently. For example, if the patient's blood pressure is low, I am allowed to automatically administer mitogen as a PRN in order to bring the blood pressure back up. However, in the other unit, I must always contact the physician before administering mitogen and reporting the blood pressure. When working in a brand new unit, it is important to learn what the policy is before assuming the policy is the same as your home unit. Let's go over a scenario. For example, the registered nurse has 3 patients. Patient A is asking for ice chips and a blanket. Patient B is asking for acetaminophen for his headache. Patient C states that he suddenly got a stomachache and it is worsening by the minute. This registered nurse cannot tend to all 3 patients at the same time. She is currently working with a UAP and a licensed practical nurse. It is essential to know which task can be delegated to which patient. Patient A can be delegated to the UAP. Patient B can be delegated to the LPN. It is within the LPN's scope of practice to administer the acetaminophen, provide ice chips, and grab a blanket. However, since the UAP cannot administer acetaminophen, the registered nurse should delegate patient A to the UAP and patient B to the LPN. Now the registered nurse can focus on assessing patient C to see what intervention should be done to alleviate the stomachache, or if there is a deeper underlying condition that is causing the stomachache. It is not in the LPN or UAP scope of practice to be able to assess patient C, so the registered nurse cannot delegate patient C to the LPN or the UAP. Here's a special circumstance that patient B delegation must be transferred back to the nurse. If patient B stated that he already took 6 acetaminophen pills within the last 5 hours, then the LPN must report this back to the registered nurse before administering the medication. If patient B's blood pressure suddenly states that is 250 over 110, the LPN should report back to the nurse before administering the medication. This is an example of reporting abnormal findings to the registered nurse, which gives the registered nurse the opportunity to evaluate the situation before the LPN takes any action. Accountability is not transfer. Okay, that's so important for you to remember that. The registered nurse is accountable for the patient. When tasks are delegated to another staff member, it is still the responsibility of the registered nurse to oversee that the delegated task is being done correctly. The registered nurse does not transfer accountability to the delegated staff member just because the nurse asked the staff member to complete the task. If the patient needs to be evaluated, do not delegate this patient or task to the LPN or UAP. If the patient needs to be assessed, do not delegate this patient or task to a LPN or UAP. If the patient needs to be educated, do not delegate this patient or task to a LPN or UAP. Before we explore the 5 rights of delegation, don't forget to go to cutynurses.com to join my mailing list, and I'll send you 160 free digital flashcards. Don't forget to click that red subscribe button below. 5 rights of delegation. The 5 rights of delegation are the right task, right circumstance, right person, right supervision, and right direction and communication. Use the 5 rights to answer the NCLEX question in order to eliminate some of the multiple choices. First, right task. Is this the right task to delegate? Can the LPN or UAP perform this task? Is this the task that only the registered nurse should do? Number 2, right circumstance. Is the patient stable or unstable? Stable patients can be delegated to the LPN or UAP. If the patient is unstable, the registered nurse should not delegate to the LPN or UAP. Also, assess if the staff member's workload is overwhelming. Do not delegate if the coworker is already handling too much on his or her plate. Number 3, the right person. Are you delegating the task to the right person? If you are a registered nurse delegating to another registered nurse, ensure that this nurse is fully trained in the task. Just because the nurse has a license, the nurse may not know how to perform the task or is too new and has not been signed off on it. I have been in a situation where I was pressured to do a task, but I was not signed off on it. Never perform any task that you have not been signed off on. It will always come to bite you in the buttocks. Number 4, right supervision. The registered nurse should always make sure that the task has been completed in a timely manner and correctly. Evaluate that everything went smoothly. The registered nurse is still accountable for the delegated task, even though the task itself has been passed off. If the task was done incorrectly, it still falls on the registered nurse. 5, right direction and communication. When delegating a task, make sure to provide the right direction. State the task clearly and how it should be completed and communicate what should be reported back to you. For example, tell the LPN to administer the mitogen 5 milligrams orally if the blood pressure drops below systolic 110. If the blood pressure drops below systolic 110 and the patient is not really responding, the LPN should report this abnormal finding to the registered nurse. Again, do not delegate tasks for patients that are unstable. An UAP can usually help a stable patient ambulate from the bed to the bathroom. However, if a patient is getting out of bed for the first time after a surgery, the registered nurse should be the one to complete this task and should not delegate this to the UAP. A patient that is freshly post-op is considered an unstable patient. Examples of stable patients. Patients with normal vital signs. Patients that are alert, oriented, and ambulatory. Patients that are conscious and comfortable. Let's go over examples of unstable patients. Patients that have abnormal vital signs. Patients that require constant monitoring. Patients that are freshly post-op surgery. Patients with rapidly declining mental status. Patients in a coma. Patients with worsening conditions. UAP, unlicensed assistive personnel. UAP are staff members that work with registered nurses to provide care for the patient. They cannot delegate duties or provide care for unstable patients. They can perform routine duties. If they are providing care for a stable patient that suddenly become unstable, they must report to the registered nurse immediately. Examples of UAP duties that are within the scope of practice include taking vital signs, getting the weight and height, performing mouth care, toileting, linen changes, feeding meals, repositioning a patient, ambulation assistance, transferring and toileting, and other stable duties. UAP cannot give medication, delegate tasks, assess, evaluate, or teach patients. UAP can reinforce teaching. For example, if the registered nurse taught the patient with kidney failure to maintain a low potassium diet, then the UAP can remind the patient to avoid eating tomatoes on the plate during mealtime. LPN, Licensed Practical Nurse. The duties of the LPN will depend on the state. For example, in Pennsylvania and New York, LPN can perform catheter care, but cannot in New Jersey until just recently. It's essential to always stay up to date on what LPNs can and cannot perform. But remember, you don't have to worry about what is different in each state for the NCLEX. Duties that LPNs can perform include medication administration, but they can't give IV medications or blood transfusion, by the way. Routine procedures, catheter dressing changes, ostomy care, blood glucose check, and etc. And gather patient data. For example, the LPNs can collect the vital signs and listen to the lung. Then the LPN can report the findings to the registered nurse. LPNs cannot evaluate the patient, provide patient teaching, or assess the patient. This is what the registered nurse is responsible for. The LPN cannot provide care to a brand new admission or an unstable patient. The LPN also cannot develop nursing diagnosis or intervention, but they can help the registered nurse with carrying out care plans. RN, also known as registered nurse. The registered nurse can delegate tasks to the LPN and CNA. The registered nurse supervises the staff members and provides care for unstable patients. These include patients that are post-op for up to several days, newly diagnosed patients, and those with abnormal findings. The registered nurse will use critical thinking and monitor the unstable patient. The registered nurse must be responsible for discharge teaching, new medications, and to develop the care plans. IV medications and blood products must be given by the registered nurse. Now, you can take what you learned here and apply your new knowledge to your NCLEX practice Q&A. You have now gained the confidence to delegate appropriate tasks to the appropriate staff member. You now have an understanding to not delegate unstable patients' assignments. If you still have questions, drop them in the comments below and let's start a conversation. If you're not already subscribed, click the red button below.